It's so exciting to be here with you today. My name is Jocelyn Birkhimer, and I'm here with Mia today. And Mia is a mind-body expert, and she is one of the most fascinating humans I think I've ever met. And I've met a lot of amazing people in the coaching and healing world, but she is one that, I don't know, for me has blown my mindsets out of the water. Like I thought I knew about healing and manifesting and all of this, and Mia was like just another level of that. So I'm excited to have you here today, Mia. Excited to chat about overcoming pain and finding freedom and really helping people ideally, have hope that what they don't know can be possible and to feel empowered with that. So I'm excited to kick us off today. Mia, I would love to ask you the question, and you probably get this a lot, like, what is it that you do? I call you a mind body expert, but I'm curious, like if you could just break it down for me, what do you do? How do you frame your work?
First, I want to say thank you. This is a sacred space, and I feel a lot of gratitude to be a part of it. And right back at you, Jocelyn. I think we have a perfect match. You are an amazing human, and please allow me to say I'm very grateful to be here in this space with you. What do I do? Yeah, I help people overcome chronic pain. So, what really I am on a mission for or to achieve is to bust this idea that we need to manage chronic pain. Why manage if we can completely overcome it, if we can release it, if we can't let go of it, and if we can live a full life without the management, without the medication, without the treatments, without the rehab, without the surgeries, without the shots, without any of this, without physical therapy, without even massage therapy, unless you really enjoy a massage, but you're not doing it to heal. So this is what I do. I help people completely overcome chronic conditions, chronic pain.
Wow, that's wonderful and probably a mind-blowing statement for some people. So let's wrap our heads around this. So what do you mean by that? First, I want to have you maybe share a little bit about what are the chronic conditions, the pains, the illnesses, like what are some of the things that you've seen that classify or work within the realm of the work that you do?
Back pain, neck pain, shoulder pain, hip pain, knee pain, foot pain. So musculoskeletal pain, IBS, anxiety, insomnia, migraines, headaches. Oh my God. Chronic, I would say, pelvic pain, chronic bladder pain, um, wrist pain, repetitive stress injuries, repetitive tendinitis. Yeah, you name it. I mean, this whole array. The chronic pain syndrome or the mind body syndrome has endless manifestations. Everything and anything can be, not everything is, but everything can be a part of the mind body syndrome. And sometimes you have some injuries, some real injuries, or some. And I'm not saying there are fake injuries, but there is damage, tissue damage, that warrants some pain. But there is some mind-body syndrome that could also be included in that which is not warranted, meaning the symptoms that are not related to that injury or to that condition, that attach themselves to that condition, or a frequency of pain or an intensity of pain that shouldn't be there, and it is there. So it could be, I see people with components of mind-body syndrome. I see people with 100% one mind-body syndrome. And oftentimes, there are, not often, but on rare occasions, there are people who will need to wait a little bit until the body finds the healing or finds a balance, and then we can tackle mind-body conditions. So there's really three phases or three aspects of this, if that makes sense.
Yeah. So the term that I think I learned from you that was new, I hadn't heard before, was mind-body syndrome. Will you
Yes.
define that for us really quickly? Like break that down. What does that mean?
Mind-body syndrome, or we call it primary pain, is that the pain is the reason why the pain is there. So the pain is the main issue. It's not because I have a bulging disc that I'm in pain. It's not because I have arthritis that I'm in pain. It's not because there isn't any cause. The pain is primary.
Mhm.
And many people don't know that they suffer from primary pain. They think that the pain is secondary. Pain is a result of something, that the pain is a result of an injury or a damage um, or a condition. Or sometimes people think that their pain is related to triggers that have nothing to do with pain, like change in weather, like some chairs, some tables. They have associated pain with some triggers that have absolutely nothing to do with the condition. So I hope this is making sense, and please ask me
Mhm.
questions as I go, because I know that is it's hard to wrap your mind around this when we live in a society that has always told us if you have pain, there must be an injury in the body. And
Mhm.
when we go to see specialists and practitioners and they look at the body and the body part that's aching and they tell you, you have pain. I see
Mhm.
this on MRI or on imaging, and that is it. So when
Mhm.
we are in this model, in this system, it is hard to wrap our mind around what I'm talking about. But please ask me questions and
Mhm.
let me on
Yeah.
as much as
I
necessary.
Yeah, I love that. I'm thinking back to, I think you and I had a conversation probably close to a year ago, and I had a knee pain that had resurfaced. And I had chronic knee pain when I was young. And I remember for years and years and years, I had this knee pain, and I thought that it was structural. And I remember explaining to you, you're like, tell me how that surfaces for you, or you asked me to explain it. And I remember you saying, like, Jocelyn, that's actually not structural. It doesn't work that way. And I had made the story in my head that was reinforcing that pain. And that to me was the first time that I was like, oh, like that is a different view. I had never thought about it that way. And yeah, so I can appreciate that. And I'm grateful that you break that down. Because I think there were quite a few things that I remember you sharing with me that you've helped people with. And I think of it as, there even can be a structural component, but oftentimes it seems like the way we perceive it or the way we think about it or the I call it the energy that we're holding around our pain can often make it worse than it even warrants itself to be. So I'm wondering, like, it sounds like there are these components of the primary pain, but how do you think about it when somebody does have like a structural challenge? Like, for example, I can remember a time that you told me that, you'd seen people that had conditions that warranted pain, quote unquote, but lived with them without pain. Like, I want to say it was discs or some sort
Yes.
of challenge. Like, tell me about that. How do you think about that structural component and the pain that you're mentioning?
So let me share my personal story. I think
Yes, please
this is
do.
going to be it's going to explain it at the very basic level. I did struggle for over 7 years with crippling back pain and neck pain, shoulder pain, mostly back pain, and it was relentless. 7 years. I would wake up in the morning wishing for the day to end every single day. The first thought that would pop into my mind, I cannot wait for this day to end. I was in my early 40s. I was at that time extremely fit. I had my children were young, and I was very active. And this pain was just preventing me from enjoying my life, from being the mother I wanted to be, from being the friend, the woman, the person I wanted to be. And clearly, when you're in pain, you go seek help, right? So I started to seeking doctors and orthopedists, and month after month, I had imaging, and my MRI showed a lot of degeneration in my spine, a lot. My cervical spine has degeneration all across the cervical. My lower back has bulging discs, degeneration, impingement of nerves. I have bony ridges. I mean, if you read the result of the MRI and you look at it and you don't know what I know today, you would be so scared to even move. And I still remember sitting in the back surgeon's office. He looked at my MRI and he said, we will not offer surgery unless you can no longer walk. At that point, there are few options. You can fuse these discs, or we can do surgery. For now, what I recommend is you go for pain management. So I did go for pain management. I went for the shots in the spine. I did the physical therapy. I did the acupuncture. I did so many things, knowing that my spine is damaged. So in my mind, I need to be in pain. I read Dr. John Sarno's book, Healing Back Pain, which talks about the mind-body connection, and he in his book explains a lot of the things that we now have tools and techniques for, and the research have caught up to that. In 2 days, I was pain-free. So when I say people think that their condition warrants pain because doctors show them MRIs or show them imaging results, and they say, this is what you have, we're matching your pain to what I'm seeing, and I'm making this as a diagnosis, and this is what you have. And this is very dangerous, because when you do this, you're not really taking into account the behavior of the pain. Now, the behavior of the pain clearly would have shown or would have helped me or the practitioner understand that this pain that I had nothing to do with the abnormalities in my spine, because it didn't fit the structural pain. It was on, off, it was up, down. It varied. When the back felt better, the neck was bad. When the neck was better, the back was bad. The pain traveled. The pain didn't act like a structural damage would act. If this bulging disc or if this impinged nerve needed to really have pain or send pain signals, I should be in pain all the time. I should be in the same amount of pain. I should be more in pain when I'm active. I was more in pain after an activity. So my pain was not behaving in any way according to a structural damage, and yet this is what I got as a diagnosis, and I this is the path that I started on. And the more you believe that your pain is related to a damage in your body, the more you act in a way, or you feel and think in a way that makes that pain stick around. You fear it, you focus on it, you try to figure it out, you fixate on it, you hate it, you give it so much power. All what I just named are things that everybody does, and it's normal because pain is a very dense experience. But what I just named are the very things that make symptoms stick around, are the very things that feed the mind-body syndrome. It's like sugar to a kid.
Mm.
And everybody do those things. So the more you do those things, the more pain you experience, if that makes sense. And you start avoid. So the more avoidance you do, the more you're telling your brain and your body it's dangerous to move. And the more your body interprets danger, the more pain signals it's gonna give you. So it's really a vicious circle. If you don't know what's going on, if you don't know how it starts and what keeps it, and how you can release it, you're just stuck. You're stuck in a vicious circle. You could go on for years. These things can I've seen people in chronic pain for 10, 20, 30 decades, 40 years. And I've seen people heal from it too. So these things can stick around for a very, very, very long time.
Wow. Yeah, I can appreciate that and resonate with it. And I, as a young age, remember having x-rays done of my spine, and the doctor said, you know, you have your neck is curving the wrong way, your spine is going down and to the right, and this and this, and that means you're never going to be able to run again. You're always going to be in pain and all these things. And it was similar to what you mentioned, where like structurally, yes, I could see something was off, but it didn't make sense. It didn't add up the way that I was feeling. And through the work that I've done now with you and some of the things that we are similarly trained in, I've learned that, your body can be in that shape, but it doesn't
Yes,
mean that it has to be in pain. It doesn't
yes,
mean it has to act or limit you and all of that. So
yes,
I'm continuously fascinated by, because then I remember talking to
yes,
you, you're like, there are all these people who have these quote unquote, challenges, whatever the doctors might call them, but they can live without the pain, right?
yes.
So I'm curious, like, if you can share with me maybe some stories or examples of what have you seen that we might not know is possible, but is, like, as far as, challenges that people might have that maybe do have a structural component or may be what they are, but actually can be different. Like, how can you be free while having that kind of challenge? Does that make sense?
Yes, it does. First, I would really like to say all pain is real. So when we're talking about the mind-body syndrome, it is very important for people to understand that yes, their pain is real. It is not in their head. The pain is real and it's a very dense experience. And usually the pain related to the mind-body syndrome can be by far more intense than pain that is related to a structural damage or injury. It could be extremely intense and crippling. So I need to put this out there because I don't want people to feel that when I say that, I'm telling them your pain doesn't exist or I'm invalidating their experience of pain. I am not. Um, Now, the new research is showing that all MRI results are normal to show abnormal results, all of them. It is showing now that because now we have funding to do imaging on people who don't have symptoms. We have the funding to study this mind-body syndrome. So we've done MRIs on people who are asymptomatic, no pain. And we have discovered tons of abnormalities on those MRIs. And also not just spine, but also knees and hips with arthritis. I'm not talking about rheumatoid arthritis. That's a different condition. I'm talking about osteoarthritis. So we see this as a normal, very normal condition in many people who are asymptomatic. It is difficult for us to look at an image and see damage and accept that that can be there and it doesn't have to be painful. It's just like wrinkles and gray hair. It might be unsettling to look at, but it is just a normal sign of aging. So that is a new paradigm shift that people need to start understanding because people hold on to, yeah, but my back is damaged. Yes, but my knees have arthritis. So we have to really bust that myth because it's not true. It is just not true. In some severe conditions, maybe, and we have a way now to actually go through a thorough diagnosis and we will know if the pain is really related to that or not. So there is a clear way. It's not like I look at an MRI and I say, you have normal aging or you should be asymptomatic. No, there is a very rigorous process that people could go through that would help us assess, is this really something related to what we're seeing or it's not? What I have seen people struggle with migraine headaches for decades, be free of migraines. Decades. I mean, I've worked with a few women who started having migraines when they were teenagers. They're now in their early 40s and pain-free. I have worked with older men, a few, I can't name names, but I've worked with older men who have had back pain for decades, decades. I have worked with someone who would put an alarm to remind him to stand up because sitting down after I don't remember which mark, the 15-minute mark or the 20-minute mark, he would be in so much pain. So sitting down watching TV with his wife, he would put the alarm to stand up because otherwise he would flare up. So when I hear these stories, it saddens me because you don't need to live with this. A structural damage doesn't act up after 20 minutes or after, it doesn't work like this. A real damage would hurt as soon as you, if you should be in pain as soon as you sit down, then you need to be in pain as soon as you sit down. Why are you in pain just 20 minutes or 15 minutes? Why do just some chairs hurt you, but not other chairs? Why is it that when the weather changes, you have an attack? Weather has nothing to do with what's going on in your body. And if the weather was really dangerous, everybody should have a headache when the weather changes. It should be damaging to all humans, not just a few humans. So what else have I seen? I've seen people heal from chronic bladder. This woman I worked with had, she would think she had an UTI, so same UTI pain in her bladder for decades. And she did physical therapy. She changed diet. She was on a diet regime or regiment to help. She was taking medication, and nothing helped other than for just a few days. When we went through this program together, she is completely pain-free. It just, we're not managing, we just got rid of it. She is completely pain-free of this pain. So people think, and it's normal that they think this way because that was the old system, that if you have some kind of damage in your body, or if you have a pain, you need to have something going on. They cannot hope that if I have this pain, this severe pain, this ongoing pain, that it can just go away. But it can, and it has been, and hundreds and thousands of people are healing with this new method, this new way of understanding and treating chronic pain.
Wow, that's mind-blowing to me even now after talking with you many times and hearing about it. It's wild. And I'm wondering, I've heard of different stories of people going through more of these, alternative, if you will, healing experiences. And I see maybe two buckets, and I'm curious what you see. It sounds like there are some people who are able to go through this alternative approach that supports them in relieving themselves from the symptoms, even if there is maybe a structural component, they're not bound to that pain, right? Are there also times where people can reverse the conditions, or what have you seen as far as different types of challenges and the way that the freedom actually comes out on the other side? Does that make sense? Or the way they experience the freedom on the other side. What are better ways to
So
say
I
that?
worked with a woman who has a severe endometriosis. Now that's a condition that is seen, that is present. So and I'm not saying endometriosis is a mind-body syndrome. There is a change, there are changes, structural changes in the uterus, and for her, it went really deep. It was a severe case of endometriosis. This woman was in pain, that pain would send her to the emergency room when it was at a flare-up, at a peak. And usually it would peak around her period. She has also been told that she could not have a normal pregnancy, that she needs to start to look at alternative ways if she wanted to, become pregnant. I started working with her, and although the endometriosis is still present, this woman is pain-free. And this woman gave birth a few months ago to a very healthy baby. And I have goosebumps because we worked through a lot of things that were hindering her energetically from childhood. And I'm not saying that her endometriosis was cured, but who cares what's there? That's the thing. Like, why do you want to hang on to something that could be present in your body and not hinder your life. I mean, my spine is damaged. I don't have pain. I run, I teach spin classes, I lift weights, I bike, I do everything. I sleep the way I want to sleep. I'm not awakened by pain. I can bend over, I can do everything. And it doesn't matter what my spine is doing. Why should it matter? Maybe it's something that my body is doing at a level that I don't understand why. But you can be on the other side. You can accept that, yeah, there can be something in my body, but I can still make miracles happen. I can still be empowered to work with my body, trust the wisdom of my body, and heal the
Mm.
pain. And what is healing? Healing is living a full life. What is healing? Is it to have a spine equal to my spine when I was born, when I was a year old, pristine? That is not healing. Healing is living a full life with no hindrances and no limitations. That is healing.
Mm.
And everybody can heal. Everybody can heal.
Mm. Mm, I love that. What about people that maybe have gotten used to the way that life is with pain? So, for example, people that have, back pain or foot pain or something, and they've learned to mitigate it with, stretching or certain routines. Is it possible for those people too to find freedom from that and not have to be bound to those routines for those things? Or like, how do you think of, the people that have found a way to manage the pain, but it's still there, like it is still something that you have to do something about every day, or those kinds of scenarios?
Why do you need a crutch when you can run? Why do you need why do you need the little training wheels if you know how to ride a bicycle? Why? If you want to, if that is your choice, then we should respect that. We should honor and respect that. But if your desire is to ride your bike, is to completely be free, then why hang on to the stretches and the crutches? And you can sleep in any bed you want. You can stretch thinking that, I mean, I'm not against stretching. I love stretching, but it's not a crutch. So everything can be amazing. I love massage therapy because I love it and I enjoy it, but it's not a crutch. It's the intention about and behind everything we do. If we're doing because we feel, if we don't do it, if it's fear-based at the very, so here it is. If you're doing something because it's fear-based, and the thought process is, if I don't do it, I'm going to be in pain, then you're hindering the full expression of your life. You're just doing that. You can if you want to, but I'm just saying, you're hindering your full expression. You're completely in the way,
Mm.
and you don't need it. I'm going to share a small story, quick story. When I was in this critical pain, I live on Long Island, and I separated, so single mom, two young kids. And my parents are, my mom is in Montreal in Canada, so are my siblings. And my mother invited me to go spend a few days, and I always said no because of the pain. It was just so tremendous for me to just pack and get the kids ready and go and sit in the airplane. It was just a whole ordeal. But I decided to go. I'm like, you know what? I haven't seen my family in a long time. I'm gonna go. She gave me her bedroom and she slept with the kids. For the first time in years, I woke up, it was maybe 9, 10 o'clock, and no pain. Because usually the pain would wake me up every single morning around 4, 5 a.m. I wake up and I'm like, huh? What happened? There is no pain. What was my first thought? What is this mattress my mom has? I want the mattress. And I promise you, the first thing I did coming back to Long Island, I bought the same mattress. It didn't work. My pain came back. I could not fathom, because I didn't know what I know today. How is it that for years, every day I wake up in pain, and all of a sudden I'm here, and a week, no pain? I could not fathom. I I did not understand that I felt supported, that I had help, that I wasn't alone, that I wasn't in fear, that I had someone taking care of my kids, that I got a break, that I felt nurtured, I felt in my community, I felt loved. A whole week, I had no pain. So that's a story. If people can relate to, sometimes my pain just goes away and it boggles my mind and I don't understand why. And I'm looking for what I did. Is it the chair? Is it the bed? Is it what I ate? It's none of that. It is none of that. It is the understanding of why you have those symptoms. That's it.
Hmm. I love that. I love that. You challenged me to think about something when we spoke, probably close to a year ago, I think around the time of the knee pain. And it made me realize that as much that I had done a lot of the healing work, right? I'd released a lot of the trauma and the emotional wounds and the stress in the body that was creating a lot of the pain that I was feeling. I was still limiting myself with my words and how I was choosing to behave because of my pain. I was going to yoga because of my pain. I was going to the chiropractor because of my pain. And you and I did some work on it and it shifted something. And I realized like I can go to yoga just because I love to go to yoga. I can wake up
Yes,
and stretch because I want to wake up and stretch and it feels good, not because I have to, but because
yes,
I get to. And I stopped going to the chiropractor. I haven't been in probably over a year. I have one chiropractor that does like energy work and it just feels good and I go see her, but not the cracking, popping because I don't need it anymore. And
yeah.
it's amazing to me what that shift can be. So I'm curious, Mia, if you can tell us like how does this work? How do you help people to get this result? I know we talked about this at one point and you mentioned there's kind of like these three phases. Like you break it down so we can wrap our heads around like how does this miracle happen?
Yes, there are three critical phases, and the first one you cannot bypass is the education. You need to understand and educate yourself about how this pain, what is pain, how does it manifest, why it manifests, and what makes it chronic. Once you understand that, once you are educated about the new research, about the mind-body syndrome, about what it is and what it's not, then you can move on to the next phase, which is examining your own life, your own symptoms. How do my symptoms fit within this framework? And once you have this overlay of your experience, your symptoms on what you already know, and understanding, oh, I see what I have now. It fits this framework. Now we can go past that through the release of what was hindering, the release and the tools and the techniques to actually challenge your triggers, to empower you to stop the fear, to empower you to trust your body and start to do things that you have not been doing, that you have been avoiding. Because as I said, the more we avoid, the more pain will come. We can really start to reprogram and reprocess these neural pathways that are there. And the best way for me to explain a neural pathway is it switches on, it switches off. A real infection, a real fracture, a real condition has a certain curve. It follows a certain curve of healing. So you have acute pain, then you see how as it heals, the pain shifts, and then usually the pain stops being there, even if the wound or the infection hasn't completely finished processing yet. Like I'm going to give you a simple example: strep throat, right? You have acute pain. You start taking the meds, you stop having pain, but the infection hasn't completely cleared. That's a real curve of something that is structural. Now, a neural circuit doesn't work that way. You wake up, you're in pain. An hour later, maybe you're not. Maybe half hour later, you're in a lot of pain. Maybe the next day, you're not for 2 minutes. And maybe a few hours later, you have 10 out of 10 pain. This fluctuation, this on off is a neural pathway. It turns on, it turns off. So I teach people how to turn off these, how to deprogram these neural pathways. And why are old injuries prime site for chronic pain? You hear often people say, I fell when I was young. I had an injury 2 years ago. I had an accident two or 3 years ago, and it's the same site. This is coming back. It's not that it's coming back. The neural pathway of this area in your body has been well established. It's easy. So the brain is optimal. When you need to have a mind-body syndrome because you have other things going on in your life, the brain is going to choose the easier, the more optimal piece of real estate in your body. And an old injury is it, because there is already a neural pathway that exists for that. If you hurt your knee when you were 3 or when you were 15, then that neural pathway exists and it's prime real estate. Then your body is going to go there. It's going to send pain signals there. Just like when people say scars are so itchy. Scars don't have nerve endings. They cannot be itchy. But they're prime real estate for people to have symptoms there, because once they were very painful. Does that make sense?
It does. And I'm almost wondering, is it in a way, are you helping people to heal the neural circuitry? Is that a way to
Yes.
say that? Or
Yes.
wow.
Yes.
Okay.
We
I'm like, I want to like sum it
reprocess.
up. Does that make
Yes,
sense?
absolutely. We reprocess neural circuits. That's what we do. We end the habits, the loops of pain by installing new circuitry, new
Wow.
ways of thought and of action, behavior, and of feeling. And this is how we stop this on-off neural circuit of pain.
Mm. Wow. That I love the way that I saw it there. And obviously I've talked to you a lot and I'm a fan of all of this, but the way that you said that clicked something different in me, which was exciting in that sense of like, oh wow, that's what we're doing. We're really healing in the mind body space through the neural circuitry to then
Yes,
experience it differently. And in some
yes,
cases give our bodies permission to actually heal because maybe it didn't have the permission with whatever was in the neural circuitry. And in other cases, turn off the signals where you don't have to have the
yes,
pain to be able to
yes.
actually heal in the sense of enjoying your life and being present and being free.
Absolutely,
Wow.
absolutely. There are a few layers. So you have the physical layer, the brain first approach. That's how we call it. You have the brain and how the neural circuits can be reprocessed. You have a second deeper layer, which is emotional processing, which caused neural pathways to exist in the first place. The fear, the sadness, the traumas, the childhood experiences, and there's a lot. I mean, a lot prime people to develop mind-body syndromes. A lot of things prime people, if that makes sense. So we do work on many different levels. And I would like to, do we have time, or do you, there is one concept that I would like to bring on, but do we have time for it?
Sure. Yeah, go for it.
So it has been now established that people who live difficult childhoods are primed. Their nervous system is hypersensitized. And so as they go with life, as they move on in life, and the stressors of life become tremendous, they have less space to process, and their nervous system gets activated in a way that sometimes takes a little thing and they're overboard. They're so sensitized that they get activated very quickly and they don't understand. Some people say, I just went to the gym. I had a session at the gym, and since then my back's been hurting. So it's really a benign thing that sends them over the edge because they have been primed. But again, understanding where they come from. A part of this program that helps people heal is to look back and understand, why is my nervous system primed? Why are little things set me off or bring me over the top so quickly when other people can manage that differently. It's like walking in life with hearing aids. I mean, if you don't need a hearing aid and you have a hearing aid and I'm talking to you at this pitch, you're gonna feel it amplified. That's a hypersensitized nervous system. They sense the danger or the stresses in life in an amplified way. So we teach them how to turn this down and desensitize their nervous system and bring in safety and space to process.
Mm. Wow, I love that. And I can attest to that because that was me. I definitely had a lot of trauma in childhood that I didn't realize at the time until I started unpacking the pain in an alternative way. And through the work that I've done pre-meeting you and also after meeting you, I can absolutely attest to that being different, right? Where before I felt like I was just triggered and I had pain, or it was like this blaring mental, emotional, or physical response. Whereas now there's space and I can witness if something pops up, what to do about it and support my body and coming back to baseline versus staying in that heightened state, which I lived in for many years, probably 20 years or longer, which is crazy. So I appreciate you sharing that because I think a lot of people are probably in that boat, just our culture and the generations that came before us. There was a lot of stress. There were a lot of
Yeah.
things that we didn't realize were traumatic or causing stress to our nervous systems. And I think we're in a place now where it's safe to talk about this and we have new methods and research being done where we know it's possible to work with the mind and the body to make a change and become free now versus waiting or going to years and years of therapy or whatever that might be. So I love that. That's wonderful. Well, I want to honor our time, Mia, that I want to share with you all that are here with us, that we're excited to share that we have built something really amazing together. And over these past couple of months, Mia and I put our heads together to figure out how do we bring this to people? How do we make this more tangible? A lot of people have to go to all these specialists and they spend hours and hours and thousands, if not hundreds of thousands of dollars trying to overcome the pain. And we said, you know what, let's build something that can help people quickly and easily and more affordably move through this and actually heal and get these results. So I'm happy to share that we just developed a 12-week program that helps people with chronic pain or persistent pain or illnesses heal rather than just manage the condition so that they can live freely and joyfully and move in their life without pain and discomfort and limitations. So I'm sharing that with you here because the three phases that Mia broke down, we put into a program to be able to help people. And the whole program is designed to teach you how to do this on your own, how you can do it without treatment, without supplements, without medication, rehab, invasive medical procedures. And there's really no side effect other than healing, which is amazing. And so I just want to share that with you that we just started this. So we are looking for a few people that can go through this as far as a beta program, as we're calling it, just to be able to get the results from this format. It's something that Mia's been doing for many, many years. Like you said, over 500 sessions you've done with people. Yes. Which is amazing. And I brought in some of the techniques that I've used to help people free themselves mentally, emotionally as well. So it's really wonderful. So I'm just going to share that here. Follow up with me after this. I'll share a link so you can book a call if you're interested in that. And other than that, I just thank you all so much for being here. Mia, this was truly wonderful. I'll pause in a moment if anybody that is live with us has questions, but I'm curious, Mia, if there's anything you want to leave people with, any thoughts for the future or things to leave from this call.
Yes, absolutely. So this program also has Q&A, weekly Q&A, where I would sit with you and answer any questions you have. So you're not really on your own. The thing that is most important to my heart to leave people with is your body is such an amazing healing machine. Your body's wisdom is beyond what we could even fathom. We are so much stronger than what we've told that we are. Our bodies are built in a way that they're really healing machines. They're self-healing entities, systems that we can't even begin to understand. Having safety in your body and starting to work from that space will launch you into a life of fulfillment, of full expression, and of freedom. Because when you feel unsafe and untrusting in your own body, there is nothing in this world that could help you really spread your wings as far as you want to and be who you really, really, really and truly are meant to be, and do what you truly are meant to do and have what you truly are meant to have. So please leave this knowing that your body is your friend and is your support system, and it is here for you. It is here to support you.
I love that. Wonderful. Well, thank you so much for being here again, Mia. Again, if anybody's watching this, I will send you a link so you can book a call to chat more if you have any questions or if you want to explore this further. And other than that, thank you so much, Mia. This has been truly wonderful.
Thank you.